What is the difference between a PEG tube and a G tube? If you or someone you know is dealing with sensitive stomach conditions like irritable bowel syndrome or colitis, you might be curious about feeding tubes. Today, we will clarify the differences between a percutaneous endoscopic gastrostomy tube and a gastrostomy tube. Both types of tubes are used for enteral nutrition, which means they help deliver nutrients directly into the stomach, bypassing the mouth and esophagus. However, they have some key differences that are important to understand. First, let's talk about the percutaneous endoscopic gastrostomy tube, often called a PEG tube. This tube is placed using a minimally invasive procedure that involves an endoscope. An endoscope is a thin, flexible tube with a camera that allows doctors to see inside the body. During the procedure, the doctor inserts the PEG tube through the abdominal wall directly into the stomach. This method is often recommended for individuals who have difficulty swallowing or need long-term nutritional support. PEG tubes are typically more discreet than other options and are suitable for those who requiring a feeding tube for more than 3 months. Now let's discuss the gastrostomy tube, commonly referred to as a G tube. Like the PEG tube, a G tube is inserted through the abdominal wall into the stomach. However, G tubes can be placed using different methods, including surgical procedures. G tubes come in various styles, including traditional high-profile tubes and low-profile tubes, which sit flush against the skin. Both designs are made to prevent the tube from dislodging and are secured with an external bumper. So, what are the main differences? The placement method is a key factor. PEG tubes are specifically placed endoscopically, while G tubes can be placed either surgically or endoscopically. In terms of design, G tubes offer both high-profile and low-profile options, while PEG tubes tend to be more discreet. Both types of tubes serve the same purpose of providing long-term nutritional support. However, the choice between a PEG tube and a G tube often depends on individual needs and preferences. For those with sensitive stomach conditions, comfort and ease of use are essential considerations. Consulting with a healthcare provider is crucial to determine which type of tube is most appropriate for your specific situation. Both PEG tubes and G tubes can effectively provide the necessary nutritional support while minimizing discomfort.